Yes. So, both pages. Find out. Mhm. Uh-oh. Did I lose it?
Look like, yeah, then you can just go there. And then
Mm-mm.
Do I need to give her rights?
nope, nope, I think she's good to go.
No, it's Word. And it's not showing up. Sounds- Not letting me share. The Word doc.
I mean, if you're able to close the rest of those things down, then you might be able to kind of.
There you go, Michelle.
All right, you got main mics. Oh, thank you.
Yeah. Good morning, everyone. They're yeah, just these. Yeah. We got a few more minutes. I've got some folks out front. Drop off situation. Yeah, I think so. You got it? Yeah. Okay. Good morning. While we're waiting for folks to show up and come together. So where did everybody travel from?
Bay Area, California.
Wow, okay.
Dallas.
South Carolina.
Michigan. Pennsylvania.
Jacksonville, Florida. What about on the phone?
That's a Penn Stater.
Best part of the season was this week's bye.
We got, well, we held in for the first half of Ohio State, against Ohio State, and we got, overrun.
Yeah, kind of the Badgers season too. They hold on to it,
Really? Yep,
and then
South
actually,
Carolina.
you know what, they lose control.
Yeah, for us, it's, they've been just losing at the end, where they just Mount, the part, I don't know what.
Phoenix.
My sister and my nephews have all kinds of theories and hear all the rumors, because where
Oh,
I grew up and where they're at, it's just.
okay, Rebecca, we
10 miles east
we
of-
understand.
My nephew works at Penn State.
Good morning.
Long time.
Just folks
Yeah.
are chiming in from
That's why my-
where they're located.
Pastors are amazing.
Should sign in.
That's what, actually, one of my
So is
nephews
Ariana
said, the men's
managing that?
really good.
She's managing the chat. Okay, perfect. Right, Ariana? You've got the chat, just in case we miss something.
Yes.
You are so good. Thank you.
There, and then, they built a new ice rink.
Yeah.
It's been, yeah, really popular, and then they've been pretty good.
Yeah, that was joining division for a lot of information of the Big Ten Hockey Conference, and everyone was like, oh, Penn State's gonna be not great, they were a club team, and then they just came in and were steamrolling people.
It's neat, they, are gonna do in-house. I'm sorry, my whole.
We were just listening intently and just, yeah.
Instead of where were you coming from? It might have been, what team were you cheering for that lost yesterday or what?
Right. Or
This
over the
weekend.
Sure. Or over the weekend, yeah. Okay. We are right at the top of the hour. We've got quite a few folks that are joining us virtually. Ariana is going to keep the two of us. Unfortunately, Kay is not going to be able to join us virtually or in person. So again, you've got us here to talk about provider information, us, Megan and myself. And again, we are here collectively to talk about provider information. We do have an agenda, and our agenda is pretty tight for today because we do think that going through the survey and really engaging conversation, because this survey is one of many that we're surveying the whole entire industry. But before we do that, I should introduce who we are and what we're about, because we do have some new folks that potentially are joining us today. Provider Information Subwork Group was created really with the backbone of focusing on provider information, which spans across our entire industry. At WEDI, we put together a request for the board to review to create a subwork group back in 2017, fourth quarter, 2018 in Scottsdale, Arizona. We were voted in to a great work group, subwork group at that time. So we talk about everything provider information. It's not just about one transaction or one implementation guide or just one provider type. It spans across everything from atypical providers to practitioners, clinicians, facilities, brick and mortars. You'll hear me, and Megan probably heard me for the first time say belly buttons and doorknobs. And again, just to separate the definition between a human individual and a brick and mortar. Any questions? I'm going to turn it over to Megan real quick and kind of have her introduce anything that I forgot, which I probably did.
Well, pleasure to be here. Thank you for those of you who are joining us virtually. This is my first time at the national conference, so I'm excited to be here today along with Michelle. So a wealth of information and knowledge, and part of what makes it so complicated is what Michelle talked about. It's a vast landscape of payers, providers, clearinghouses, and vendors. And so when we put together surveys, trying to do so with intentionality to get feedback and understanding that helps us drive education, planning, resources, and honestly, where we can help support the industry holistically. So when we talk about a survey, and we've introduced it over the course of several weeks, we've got great feedback and some tweaks to be able to be made. What it's looking to be is about a 10-minute survey. It's 18 questions, but 4 of those are branched questions that allows you to go in. Again, if you are a provider, you get to skip answering it like you're not a provider. If you're a payer, a clearinghouse, or a vendor. So to really be specific about the information that we're capturing, so the output can be as useful as possible. The second piece to it is also saying this is to understand bottlenecks, pain points, current landscape of WEDI members, but also non-WEDI members. So when we send this survey out, looking to launch it on November 10th, it'll be open through December 17th. From there, right, it's about how do we take that information and really use it in a meaningful way. So we can spend time going through this survey. Michelle, can you talk them through about where they can access it? And then we'll spend time just kind of diving in on each of the questions.
Sure, that's great opportunity. If you have not been a part of the survey discussions, Ariana has a distribution list of everyone that has signed up for the provider information subwork group. If you have not registered for our subwork group, feel free to, in the chat, if you are logged in through Whova or Zoom through Whova, feel free to send her a chat real quick, giving her your name, your organization, and your email address. And that will get you in the circle of communication around the survey, what we're trying to do next, and also our agendas. Because again, that's super important. Also, anything that you have to add, anything, we ask, please bring thoughts, ideas into our conversations, because again, this is our first survey to the industry. And again, it's not just about providers. It's provider information and also spaces that Megan talked about. Clearinghouses, vendors, trading partners, organizations that potentially need to exchange provider information for different reasons. Provider directories, for instance. There may be some organizations that transact provider information just for directory data, or it could be claims related. Again, provider information spans across everything that we touch, even invoicing. So if you think about those DME providers, invoicing, provider information is included in those invoices. So a lot of information here. Again, our schedule, our agenda is always available. Also, if you haven't registered for members only space in WEDI, go to wedi.org and register so that you can access our provider information subwork group folder that encompasses a lot of information. It's pretty heavy in data. It's information sharing. It's also NPRMs. It's also additional state regulatory, even local county information around provider data. So again, it's not just at the federal level. We've taken it to the next levels, which includes state and local. Any questions? Go Jags, by the way. 1 point, but we did it. Just had to throw a football out there.
Yeah. Anything in the chat that we need to look at? I saw some activity, but it might have just been a flurry of communications with Ariane.
It looks like just communication. Okay, yep. So far, so good. Go Jags. That's right, Travis.
I'll just cry
Absolutely.
with the Lions loss over here. as a mission.
And FSU won too. Oh, yes, they beat Wake Forest. Hi, good morning. So again, just want to say thank you. We appreciate you coming far and close to our meeting today, whether it's in person or virtual. Super excited for us to talk about this survey. Yes, it has been a year in the works, but it's so worth it because again, we're looking at getting to the industry in ways that don't bottleneck or preclude or pull out. We want the entire industry to respond to the survey, which is going to lead to additional opportunities, whether it's on the Hill, there's going to be some questions that are going to come back, maybe not in the way that we were thinking that the industry is looking at provider information. So again, maybe make a recommendation through the WEDI Provider Information Subwork Group and the WEDI Board to go on the Hill to make a proposal for provider information. And I know directories, credentialing, provider enrollment are at the tops of everyone's minds, especially with information blocking. That's also another area that we've heard from some of our WEDI membership is provider information. If the directory requirements from an ACA perspective do require health plans to suppress a provider that has not responded within 90 days of reinforcement of that attestation to attest to the data that the provider or the health plan is displaying in a member consumer-facing directory. So again, there's questions about that topic that we need to make sure that we're mindful of going into additional discussions, educational opportunities, and anything else this team is interested in moving forward with. We've heard from our providers. They do not want papers. They do not want papers. They do not want additional emails. What they want from us is giving a podcast, a 20-minute, even 15-minute information brief. Tell me what I need to know, and then tell me by reinforcing at the end of that podcast what I need to know, because I can put on my headset, and while I'm not seeing a patient, I can listen, I can obtain, and my staff can even hear the same thing. So again, that's one thing that our providers have reached out. Some of our clearinghouses have suggested that as well. Podcast, YouTube videos are the other. We've also been talking about YouTube videos and podcasts. So there have been 2 podcasts that have been conducted over the past year. So YouTube videos are super important. That is something else that WEDI is really looking for the opportunity for all of us to participate. It's not just about 1 or 2 organizations here at WEDI, it's everyone participating. So again, ownership is super important. We're here to support you with getting you the tools that we need to collectively make sure we're educating and informing and doing it in ways that's going to be received based on the industry's ask of us. So what other questions do you have besides looking at this agenda before we look at the actual survey? Does this agenda look pretty decent for everyone? Does it work? I know we've got end of year implementations. We've got holidays for the next month and a half, 2 months, if you will. Some folks are taking winter breaks in January, so I guess 2 months. But we want to make sure we get this survey that's going to position us for additional work and opportunities in 2016 and beyond, because it's not going to stop at 2016.
To 2026.
Oh, boy.
I wish it was 16.
Yeah, 2026. Can you tell I stayed up late last night watching the football games? A couple of other things. Ariana is our gatekeeper for our surveys, and she has done a really good job of taking feedback, consolidating information. She's going to be also the publisher of the Survey Monkey that goes out to the entire industry. We need to make sure that we collectively, we here are supporting this survey outwardly. So again, just want to make sure as a provider information subwork group member and a WEDI participating member that we circulate this survey. Because again, it's not a typical survey. It is a very consolidated, concise survey that is driving additional opportunities. And it's super short, by the way. I think Megan shared. I think you can take it in maybe 5 minutes if you're not interrupted. But again, depending on who you are, if you're a provider, you're going to have maybe 1 or 2 additional questions versus a clearinghouse. Or if you're none of the above, thank you. We appreciate. Have a good day. So just want to make sure everybody understands it is an interactive survey. And again, it's not a lengthy survey. It's 10 questions max. So the timelines we do have here, Megan already shared that we're going to keep the survey open till December the 17th. December 17th, the provider information subwork group co-chairs are going to look at the overall survey results and get prepared for the December 18th provider information subwork group meeting so that we can share those results, have a conversation. So we've already got our meeting scheduled. We do have, again, quite a bit going on in November. And of course, Michelle forgot to put the November meeting on here.
It's the 20th.
Correct. So it's up here at the top in yellow, but it did not include that here. So let me go ahead and make sure I include that.
They're not here typing while people are watching. I can't handle that.
Anything else that you see on here that maybe we need to alter or change? Okay. So the agenda looks good. Do we get approval just to move forward with the agenda? Okay, see nods. Ariana, do we have thumbs up?
We're all good.
Okay. Okay, great. So we're gonna move forward with this opportunity and I'm gonna stop sharing and then gonna reshare here in just a second. Bless you. And this was from Ariana. Yep.
Maybe I'll
Okay.
just hit the ground rules of it while you're pulling it up.
That sounds like.
So I think it's important to note we're looking for anonymous information, but you'll see the branching that we're going to go through is really to get to the heart of who's responding so that we can understand how to tabulate information and also then share it out in a meaningful way. So when we're looking at this survey, 5 to 10 minutes, the first question is really about, tell us about what piece of the industry you are coming to us from so that the branching of the survey follows that in a very meaningful way. So does your organization manage provider data, enroll providers, credential providers, maintain provider directories, right? We're looking at the full gamut of provider data management. From there, it'll instruct you in what area of the survey to go to. When you're looking at, I think it's the other one, that one was track changes, but
Yeah,
there's another
I
one,
was gonna show the Corey one.
the Gordon one. We've had lots of iterations. Nancy's been so great about working through them. But ideally what it's going to do is go into the different questions that'll direct you to through the survey. So as Michelle pulls it up, once you've answered question 1, it'll branch into question 2 and 3 and 4 and 5. So which of the following best identifies your organization? It's a simple drop-down list that then branches you into either the provider-only questions, the payer-only questions, a clearinghouse question, or vendor only. From there, we're going to start to get into the meat of the data, which is talking about PDM questions, looking at approximate cost. This has been an area of analyzing what's been happening in the industry and how organizations are actually attributing cost, spending additional dollars that are coming in through your organization. So this is with credentialing and maintaining provider directories specifically. So drop down list of range of dollars. Again, once you've gone into the branching, it's starting to say, we're going to be able to categorize the answers that are coming out from there. What do you consider to be your source of truth is probably the dominant area of the survey of understanding where people are pulling survey information from, source of truth information from. And this starts to look at credentialing and provider directories. So we're trying to segment the information to get answers back that correspond accordingly. So selecting up to 3 would be kind of your main areas of focus for credentialing, and then also in the areas of provider directory. From there, we're going to enter into looking at which one of these is best identifying your organization as it relates to interoperability and transparency. Again, it branches into credentialing, and then it also looks at provider directory. And that's in particular because some of the answers can change, and some of the responders can change based on how they utilize that information. Selecting up to 3 is also going to give us kind of the top areas of focus. Question number 12 starts to look at what data do you currently use in your credentialing? So this is looking at actual data that you're using and pulling and populating. So we've gone from source to what's the actual data that you're looking to compile and helping understand all that are applying. From there, it skips down to a very similar question in provider directories. And I actually think this is going to be interesting when we overlay. We're collecting information that's used in a variety of different ways. And are we looking at different information that comes to provider directories? Without a standard subset here, I think this is going to be a great idea to give us where we've got differences in the industry, but also the who is, the user that's going to be able to specify what's important to them. When we start to looking at how do we manage this data on a day-to-day basis, how are we managing it for credentialing is question number 14, and then again, separately for provider data in your directories. Question 16 starts to look at which of the following does your organization use to manage their expirations. This has been some pretty specific discussion we've had in this work group to understand that this is an industry issue, but also understanding how are people utilizing information, and we're starting to see any trends here. Question 17 takes the same question on expirations into your directories. Lastly, 18, rate your level of support of the federal government establishing a national provider directory. Obviously, this is a hot topic, one that we'll be spending time continuing to focus on here at WEDI, but also in this specific work group. And this is just to gauge where people's heads are at and receptiveness to this on the national end. Again, questions that are meant to be very specific and branching. So I think our iterations have gotten us to a really clear path when you're filling this out, how it applies to you, so that we can take information and have it meaningfully segmented back out to take action, which is the whole point. The second piece is to also make sure that it's easy and yet comprehensive at the same time. And I would say that's the secret sauce of survey making for sure. Right. The timing to be able to do that, as Michelle talked about, not only do we want any feedback, this also goes to those of you dialing in virtually before we finalize the survey, but then our job, as Michelle talked about, is to also disseminate. The survey is only going to be as good as the responses and the opportunities that we're able to garner. So not just sending it out within WEDI, but throughout your network. What, if anything, did I miss in reviewing the survey or questions that we've got? Got a mic? Got a mic. Use it. And this isn't our first round of feedback. We've been through several of them, so I'm also not going to be surprised if we don't have a huge amount at this point. Ariana, anything coming through on the chat?
Nope.
We're a quiet group in the kickoff session this morning.
It's super early.
Yeah. Actually, Michelle and I were talking this morning. Some people, as we were getting Ubers, nobody seemed to know what time it was with the time change. So people were either going to be really early today, but probably not late.
So there is something that just popped up in the chat.
Okay.
You want to read that?
Yeah, it's from Diana with Medicaid UT. Is this intended for providers only, or can payers pipe in?
Yeah, absolutely. Great question. So in the very initial branching in the first 2 sections, you're going to either respond in question 2 that you're a provider, a payer, a clearinghouse, or a vendor, and then it will branch you through that. So it's for everyone to be able to answer. Thanks for the clarification.
Nope. All right.
Any other comments? Question?
So how close are you to being ready to publish this? You know, or is this like the last wave of feedback and then you're pretty much ready to publish? Cause good, yeah,
Final.
I don't find, congratulations.
We hope.
Well, sending it off to the board and oops, and we get approval this week, hopefully, or no later than November the 10th. Any other questions? Opportunities? Who would like to lead a YouTube series? Any takers?
What is the YouTube series?
Whenever you want.
If you're leading it, you get to decide.
You need to be able to sing.
Michelle, what does it consist of?
So typically in the past, our YouTube videos have been very concise to a particular topic. So provider directories were a specific topic. So we did have one YouTube video that was created around provider directories. But the other ones are coming up as, what's the next step? You know, if a national directory is something, what about at the state level? Because some states, Colorado, have their own state directory requirements. California does too, even though they have 16 entities feeding into the Senate bills and House bills for their state directory. So again, it's up to what you feel. What have you heard? You bring it to the group, we all chime in. We say, okay, yeah, provider enrollment is a huge topic of discussion. Or even billing. We could work with claims. We could work with other sub-work groups and work groups and task groups to talk about what's next.
I think a good topic would be around information blocking and provider directories. I mean, when I heard that, I was like, ooh, I didn't even think about that. Yeah, that would be kind of a nasty one, but to start raising awareness of that, because when you start suppressing information and then people can't find information and there's penalties for that. How are we gonna handle it?
Yeah, Rob from WEDI. My thought is because, WEDI is all about data exchange. Is there an opportunity for the sub-work group to discuss best practices in terms of how does the data move from point A to point B? I think that's a persistent problem today with directories, that there's not a consistent way of asking and receiving the data. A lot of times we use the fax machine. And so is that an opportunity to come up, maybe to, talk to some payers and providers that maybe have had some success and say, what are the lessons learned that we can apply to the industry?
Great suggestion.
I was gonna say, while you're walking over there, Rob, I think that some of our survey questions will also get to the heart of that, of showing where the bottlenecks and pain points are that could generate some of that discussion.
And I was gonna tack on to, I think maybe some of the results out of the survey will help to point to, because in some of those questions where you're asking, pick the top 3, you'll start to see, at least you could maybe see if ones shake out and are not popular, but what are the others that are being used, and then dive into that a little bit further in terms of what makes that successful. I was wondering, so everybody's always talking AI now, AI is the solution to everything. And I was wondering, is there any talk, I haven't heard people talking about using AI in provider information specifically. Is that something that people are considering, looking at, trying to see how that could fit into it? And I am not a technology person in the least bit, so I don't know how you can put AI into that, process and how that would potentially be, but I was just curious, since that seems to be the solution to everything. It's like the monkey or whatever you call it, the Swiss Army knife.
Nancy, maybe it's an area that we add as one of the drop-down items to gauge if anybody's actually using that meaningfully today, probably in the management section. So I'll add that.
Yeah, that's a great thought. That just made me think of something. Maybe there's an opportunity to leverage AI for data quality control. Like we all probably know that like the MPES data quality is terrible. Particular, I've seen things where like they ask providers to enter in like their web service endpoint URLs. I've seen people put in their personal Yahoo email address
Yeah.
for that, stuff like that. So it seems like it should be possible to automatically detect some of those obvious data errors using some of those AI pattern matching technologies.
Yeah, and the taxonomy codes are notoriously bad in NPES too.
Yeah.
Like physicians who are also contractors, like really, you build ramps and stuff at people's homes and you're a physician? Like, wow.
I mean, I think this is a really interesting topic, and maybe it's an opportunity for the provider information subwork group and emerging technology subwork group to collaborate. Happen to have all the co-chairs here in the room, but some of the co-chairs, but maybe it's an opportunity to collaborate on that topic. And explore even, I mean, like, to me, that's like a series, how it, and seems really interesting and could garner a lot of input and conversation, but I think it's a good opportunity for collaboration across the subwork groups as well.
I think there's some areas there that coming together, there are things that are working, but are also areas that can be problematic. So an example, AI agents can pull the most frequently used, but not the most accurate, 'cause the most accurate might be what's brand new and coming out. So how do we take those learnings and start to address them? Question.
Mary Lee Stein from Aetna and the WEDI chair. I was just noticing in the chat that Rebecca said that dental is using it. So when you're doing that collaboration, get dental in there as well.
Rebecca does have her hand up as well.
Okay.
Yeah, I don't want to cut the conversation short, but I actually did have a question for the group, and I am not a provider credentialing expert, but I have them in my team. But one of the biggest challenges that we're finding when it comes to provider directory is when there's been talk about suppression from the payer side, where the response isn't in from the provider, and so they suppress that. But we're actually seeing the opposite problem where the provider has provided the updated information, and the information is incorrect in the provider directory, and it's taking 3, 6, 9 months, and multiple phone calls. And I was just wondering, has this group talked about, the provider ability to suppress information from a directory, and what approach we might be able to take to solve for that?
Great information, Rebecca. So we're going to take that one back as well. We've got quite a few great opportunities. I wanted to add something just real quick. Machine learning, to Nancy's point, to everybody else's point, is becoming more obvious and more friendly in all of our environments. So machine learning looks at patterns, behaviors, and picks up those types of aggregation of information so that the provider may not need to enter or re-update their data, because guess what? They haven't changed. So the pattern is learning that this provider is staying in the same service locations so that they're not presented with that level of information. Artificial intelligence plays a major role in everything we do. But the data, the quality of the data, to Megan's point, may not be there yet, right? It may get there tomorrow. It's not there today because the provider hasn't entered any differences or attested and validated that information. So I think machine learning, it may not be as obvious to all of us in the room, but machine learning
is taking place. Patterns and behaviors are being monitored. Trending data is coming from machine learning, and artificial intelligence is next. I think we're gonna see quite a bit of change.
But that's what I was, that's what I was gonna speak to is that, you know, if you ever put in somebody, done a reverse phone number lookup on the internet or done something like that, and it pulls all the data and has the understanding and the analysis built into it to understand that, okay, well, this information is very new, or this is old, and it can help advise you. So it may give you a lot of information that you might have to dig through. But having a lot of information many times is better than not enough information. So if it saves us all time overall, as those tools get more and more powerful to synthesize that data and be able to provide it right most of the time, you know, like, just like Amazon, how do they know what clothes I like to wear? You know, they know stuff somehow. And, you know, this information is out there. So many, it's in our mailing address, it's in our taxes, it's in all the different places our numbers are used. And that can be pulled together to build its own directory that doesn't involve anybody attesting to anything potentially. Right. So I think that's a great topic. Great.
So it sounds like we've got partnership between work groups. We've got AI, machine learning, data aggregation, provider credentialing, provider information blocking. We also talking about information blocking overall, meaning pulling a provider out of a consumer-facing network when the provider has a contractual agreement with that health plan, but the membership of that health plan is unable to find that particular provider. So there's a lot of information that we've gleaned from this morning's session. And again, we know we're not competing with another work group meeting, but since we didn't do an introduction, I'll save that for last. Okay. So we're gonna go around the room. We're gonna introduce ourselves so everybody knows who we are, who we're with, and what is driving us to this sub-worker. Is it data? Is it AI? Is it contribution to help support providers, members ultimately, because our North Star is patients. And again, if you think about provider information, we touch everything. So Rob, in the back of the room, we're gonna share the mic, your name.
And Michelle, maybe online, we'll have people write into the chat and share as well. So we've got 30.
Rob Tennant with WEDI, and this has been a passionate issue for me for decades because it seems so simple, right, to move the data, because it's one of those rare things in healthcare where everybody wins if the data is right? The payer wins, provider, and most importantly, the patient. So a lot of work ahead.
Mary Lee Stein from Aetna. I work for a payer, so obviously I hear a lot about provider directories, but honestly, as a patient, it interests me the most because it's very, very frustrating on provider directories. So I'm interested in improving.
Jessica Wilson with Blue Cross Blue Shield of Kansas. I just joined our interoperability area, so I'm checking out the work group to see what I can learn. Fantastic, glad you're here.
I'm Drew Boker, Blue Cross Blue Shield of Kansas. This is my first time attending WEDI overall, so I'm just checking out everything.
Good morning, Amanda Abbott. I am one of the co-chairs of our eligibility and benefit work group with Miss Donna Campbell, for those that may be familiar with her. I haven't seen her yet, so we'll see. I've never attended this sub-work group, I'm ashamed to say, and so I wanted to take the opportunity to make sure that I am in the room and learning and potentially attending as I can throughout the year for your regular meeting. So learning a lot so far and look forward to more. Thank you.
Hey, Michelle, the sound got really quiet for those of us online.
That mic is on.
Yeah, we can't hear anything at all.
Yeah, Michael, I don't know if the mic died or not.
Good morning, everyone. Brenda Rowe from Mayo Clinic. I am very excited to be here. This is my first WEDI conference. I am joining the board this season and sitting in on all the work groups. Certainly data and integrity is what drives us, right? If we get it right, we think about registration, sometimes getting it right, but I think if we push it back to the provider, that's where we need to start getting it right. So excited to be here.
Andy Norgord from WPS. We're a small payer in Wisconsin, mostly doing contract work for TRICARE and Medicare. I've been doing it long enough to see that the small errors in the data can blow up every downstream process. I'm excited to get clean data.
I'm Allison Slayton. I work for Cognizant. So we are just excited. We're a technology vendor and intermediary. We also are a clearinghouse. So just figuring out how we can support our providers, but also our health plans. We also have many interoperability solutions. So just how do we make sure that data is accessible? And this is also my first time at WEDI. So excited to be here.
My name is Jeff Larson with UGAN. We're clearinghouse and provider solutions with Utah. This is my first in-person WEDI. Been to a few of the digital, but this first in-person is so glad to fly out and enjoy this beautiful scenery. So yeah, we're definitely looking at just what elements within the provider organization and solutions we can help facilitate.
My name is Greg Lobato. I'm also from UAN. Jeff and I work in the product organization. We have a few team members who participate in a lot of sub-work groups. One of them, Boyd Creek, he's always asking us to get more involved because he can't cover everything. So we're kind of auditing a couple things to see if there's anything that makes sense or we think we can help out. But yeah, both of us first time out. And our colleague, I think, maybe joining us virtually today. And he's joining.
Morning, I'm Beth Davis. I am one of the co-chairs of the claims sub-work group and the data exchange sub-work group, and also the No Surprises Act task group. And I really like, I'm very interested in the provider sub-work group. I work for Veridon. We are a clearinghouse provider vendor primarily, and I'm very interested in being able to exchange provider data electronically, specifically around the enrollment pieces, to get that automated so that we don't go through the headaches we go through as a clearinghouse trying to re-enroll providers. And so provider directories is a big deal with that piece. So
I am Pam Brose with PNC. I'm on the WEDI board and I co-chair the Workgroup Leadership Committee, the Data Exchange Work Group, along with Beth, and then I also co-chair the Remittance Advice and Payment Sub-Work Group. So I've been involved with WEDI for a long time and feel really strongly about the work that WEDI does and what we're able to provide to the industry. All of our sub-work groups do such a great job at doing that, and I think provider information is one of the critical sub-work groups because, I mean, just as we saw a year ago, as we're trying to go through a major event in the industry, enrollments ended up being a big obstacle there, and provider information ended up being a big obstacle there. So how can we improve that? How can we make that better going forward? I think is a really big issue that we need to address.
Good morning, Nick Radov from STEDI, which is a startup clearinghouse primarily focused on the digital health market. So my interest in provider information is mainly just for data quality to make sure that our transactions get through cleanly with no errors. But I'm also a co-chair of the emerging technology sub-work groups. Obviously, there's some crossover there that we just discussed.
Hello, my name is Adam Culberson. I'm with DWA. Currently our standards guru, and so it's I guess I second WEDI meeting, way back in the day. Saw Rob and, was involved in what was it, virtual clipboard. So lots of nice projects coming back, but specifically I'm working on open scheduling. And part of that is we're working on something called bulk publish, which potentially could be a new source of provider data. And also previously spent time at the Office of National Coordinator as a HIMSS Innovator Residence, where I spent 4 years studying patient matching. So definitely also interested in provider data quality. EPU also funded some work that we did follow on. So we did a couple nationwide data demographic surveys. So we'd be happy to sync up on provider data quality and also potentially, just what the different sources are, because that's one question in my mind. There's so many different sources of provider data, which one's accurate, which are the most accurate, which ones have the best use cases. And I may be open to doing a YouTube video. It's more of a partnership thing. I don't know. Every time I see myself on video, I'm like, oh man, but I'll put myself money.
We'll do a podcast. We'll try it out.
Hi, Nancy Spector with the WEDI staff. Just general interest for me in this area and just the overall idea of wanting to solve one of the many problems that is part of our healthcare system.
I'll go as well, Michelle. So Megan Schmidt, CEO of Medikit Health. We are all things provider data and data technology. So provider enrollment, EDI, and PDM at heart. So excited to co-chair. Michelle has been bringing me up to speed. What a phenomenal partner in crime. And then we also have Kay that is the third leg of our stool as well. So I'm excited to be here. I'm excited to hear the people around the room and all of the great things that we're solving for as well. So couldn't be any more excited.
Yes. Super excited and want to say thank you again from traveling far, close, near, etc. Looks like we've got quite a few folks on the phone, and Ariana, Michelle Berry with ability. Forgot to say that earlier or just a few seconds ago. And Ariana, we've got some folks that are on the call.
We do. So a variety of different places coming through. I love people are here to learn. So I am too, what's happening in all of the subwork groups. So today is a great opportunity to do that in an introduction to WEDI. It looks like we've got people looking for updates, credentialing, operating rules. So we've got Don, Diana, Cheris, a variety of overall the things that we've talked about. Utah Medicaid. I love this. Randy from Blue Cross Blue Shield of South Carolina. Excellent. And this will be published. The chat will be published as well. So feel free to keep adding in and we can see where everybody's coming from. But to me, I think a great piece of this is connectivity. It becomes a network of people that you can reach out to and connect to regardless of the work group with just great expertise. But I will be happy to support podcast and YouTube as well. And I like about those, sometimes when we send things out to the universe, we're not sure what the response is. And I like that we can get real-time feedback of this met the mark, or here's more questions, or here's what we'd like to see in addition. So I appreciate those that are raising their hands.
Yes. Any other suggestions, opportunities that you have? This is the forum to bring them up. If you hear something in the industry that resonates with health plans, clearinghouses, vendors, providers, and even getting together with maybe our friends at AARP to really discuss how important it is to ensure the consumer, the beneficiary, the subscriber, the dependent understands provider information. What does that really look like? So again, maybe some opportunities to partner with some of our other agencies that are available. Also, if we can, Rebecca, if we could partner with you and team, we would love that opportunity from an ADA perspective. And even AHIP, American Medical Association, Tammy, unfortunately wasn't able to make it. So hopefully we can get, some opportunities to connect with also the AHA as well. So yes, Nancy. Oh,
So,
I was just thinking of some other topics, to talk about, and I know that, I think this was part of there's so many things that had happened around the same time, but part of that, HHS make, health tech, better
Mhm.
event. There was the talk about the National Provider Directory and, CMS, having that interest, or that might have even gone back to the June when they were announcing the different activities. But, and I know, that there was, in the, contracts database, the government contracts database, there's a, like the flag of $1 for, I know Availity is one of those companies, but, so it sounds like there's, this ongoing progress on this idea of a national provider database. And I'm wondering if at any point in this, how that will come together, like sometimes with the government, they give the contract and contractors go off, do their work and bring it back, but then sometimes within the government, it's like, here's what we're thinking of, we want comments on this. So I'm wondering if, depending on how that work progresses, if there's opportunities for us as WEDI to submit comments on what's being worked on, if we get where they, put something out and say, this is what we're looking at, we want public comment. So just thinking that we should keep an eye on the work going on there and see if there's places where we can insert our expertise.
Right.
Thoughts.
Yeah, it's very short order because I think it expires on November 13th. So at our 20th meeting, we might have an update and we'll certainly put that on the agenda because those
Yeah.
contracts were September 30th just through November 13th.
Yeah, and I don't know contracting stuff. I haven't really followed anything on the government side. Is that exactly how, is that they're just earmarking and I don't know if the government shutdown has,
Yeah.
affected all of that, I'm sure
Most
it
likely
has. Like I said, it'll be interesting to see if they, within CMS want to bring forward draft or proposal type work.
Proof
to
of
the
concept
industry.
is, I
Yeah.
think, what's coming out of it, or
Okay.
potentially is what's been shared. So
So yeah, again, great if we have a chance to provide.
we got to stay
feedback.
close to that. Yeah.
Yeah, and if we don't have anything in November to share, let's keep it on the agenda,
Yeah.
right? Because as things, to your point, become more available and information sharing opportunities are there. To your point, I think it's super important that the industry does respond. And even if, and this is Michelle Berry, product side of Michelle Berry from a provider data management, it's super important to get input, even if you're not asked for input. And I think WEDI does a great job of putting together a comment or a response to an event, right? And I think, Nancy, to your point, super important that we do that. I really do. I think that's where, the charge comes from this particular provider information subwork group and make it an opportunity for us. Because without our voices and without this expertise in this room, and if I'm calculating in my head correctly, we have a ton of expertise in this room. I'm not talking years, I'm talking really dedicated expertise. So if we could put together something, if everybody is okay with that, maybe take a look at it in December, schedule for January, our meeting in January, and make an opportunity for us to come together and make our voices heard. Because regardless if we're given the opportunity, it's super important that we make our.
I might be going out on a limb and Rob is far enough away from me in the room that he can't.
Which mic
hit
is
me.
this one?
This
is.
But WEDI is, planning we are planning a winter forum in San Diego in February. Everybody thinks San Diego, February. But I wonder if, something around provider directory, I know we've thrown out a couple of topics for the content for that
Mhm.
forum, but I don't know if we've got something that we could
That's,
work on around, again, going back to patient's experience with provider directories. And then if there's some progress in understanding what's the national.
Kind of goes to what I was saying too. About, you know, it affects the patient.
It does.
Yeah, exactly. And so that might be, something, I don't, in whatever format we wanna try and put that into, but. something to think
fantastic.
about.
That's great. Fantastic. Behavioral health represents, absolutely. I think that's super important. We continue to even get into specifics around PCP. We've heard from some of our PCP groups, primary care. Folks our physicians are saying, we have a voice in this as well. So again, hello, welcome. We're not gonna put both of you on the spot real quick. But the gentleman with the Michigan, could you please introduce yourself? And we're saying who you are, but not everybody else knows who you are. Joe.
Hi, my name is Bill Bell from, Thrive. I'm manager of clearinghouse support services, payer support services. And,
Michelle, you do have Chuck's hand up in the chat or in the online. Oh, it went away, so maybe not.
Hello, Chuck Faverka here.
Yep.
Can you hear me?
We can.
Well, good morning, everyone. I'm sorry, kind of lost audio there. I couldn't hear the gentleman that was speaking. Would you mind repeating that?
I think we just got on the audio, Joe Bell, right? From Thrive.
Thank you.
You bet. We're getting the mics. I think they're cutting in and out, but we're trying to get them going.
Okay.
We've got one more.
Hi, I'm David Cantor. I'm our general manager of our clearinghouse business at Steady.
Perfect. Thank you so much.
Thank you.
Excellent.
First time at WEDI. Thanks for having me.
Great. Well, Michelle, we've got 4 minutes left to wrap. On action and next steps, we've got our 20th meeting on November 20th coming out. But for those of you that are new as well, Michelle and I are happy to spend time chatting outside of today's discussion, talking a little bit more about the work group specifically, but it is usually vast representation across the industry, which is something that I find extremely fascinating. And we're also looking for partners. We're here as your co-hosts, but it's a roll up your sleeves opportunity and where do we want to help engage? So whether it's podcast or YouTube or other ideas, helping us sort through survey, we're always looking for the support that we certainly help coordinate and champion along with our partners at WEDI, but it's really the collective thoughts of everyone coming together that makes it the most useful and valuable information that comes out of it.
Absolutely. Well, thank you again, everyone. Enjoy your week. If you have any questions, feel free to stop in, have conversations. Appreciate your time today. Looking forward to seeing you the rest of the week. Thank you.
Thanks, everybody. Thanks online. Thank you.